Warm greetings, dear viewers. Today we dive into an essential part of our lives, often overlooked, our sleep. We all love a good night's rest, don't we? It rejuvenates us, prepares us for another day, and well, it feels great. But what if that peaceful slumber eludes us? What if our nights are filled with restlessness, interruptions, or even fear? That's when we enter the realm of sleep disorders. These are far more common than you might think, affecting millions of individuals worldwide. The effects can be mild or severe, but they always impact our daily lives. In this video, we'll delve deeper into the world of sleep disorders. We'll explore 6 types of these conditions, each with its unique characteristics and effects on our well-being. Understanding sleep disorders can offer us insights into our own sleep patterns and help us take steps towards healthier sleep habits. So stay tuned as we unravel the mystery behind the 6 types of sleep disorders. Starting off our list, we have the most common sleep disorder, insomnia. This sleep disorder is characterized by persistent difficulty falling asleep or staying asleep, despite having the opportunity to do so. The main symptoms include trouble sleeping, waking up too early and not being able to fall back asleep, and experiencing frequent awakenings during the night. Those suffering from insomnia often wake up feeling unrefreshed, leading to daytime sleepiness, irritability, and a lack of concentration. Insomnia isn't just about staring at the ceiling at 3 in the morning. It can seriously impact your daily life. It can affect your mood, your energy levels, and your overall health. It can make daily tasks feel more difficult, and can even impair your performance at work or school. Remember, if you're dealing with persistent insomnia, it's important to seek help from a healthcare professional. They can help you find the best treatment options to improve your sleep and your quality of life. Now that we've understood insomnia, let's move on to our next disorder. Next on our list is a rather serious disorder known as sleep apnea. This condition is characterized by the cessation of breathing during sleep, often for several seconds at a time, leading to a disruption in the sleep cycle. There are 2 main types: obstructive sleep apnea, where the throat muscles relax, and central sleep apnea, where the brain doesn't send proper signals to the muscles controlling breathing. Symptoms can include loud snoring, waking up with a dry mouth, morning headaches, difficulty staying asleep, and excessive daytime sleepiness. But it's not just about snoring or feeling tired. Sleep apnea, if left untreated, can lead to a number of health risks, ranging from high blood pressure and heart problems to type 2 diabetes and metabolic syndrome. It can also affect mental health, leading to issues like depression and anxiety. With sleep apnea behind us, we're ready to delve into our next sleep disorder. Moving on, we have a disorder that could be quite disruptive: restless leg syndrome. This is a neurological disorder that creates an overwhelming urge to move your legs, particularly when you're trying to rest. It can feel like a creeping, crawling sensation, or even an itch you just can't scratch. People with restless leg syndrome often experience these sensations most intensely in the evening or at night, making it especially difficult to fall asleep or stay asleep. Now you might be wondering, how does this impact sleep quality? Well, imagine trying to settle down for the night, but your legs just won't stay still. This constant need to move can significantly disrupt your sleep, leading to daytime fatigue and impacting overall well-being. It's a disorder that's not just about restless legs, but also about restless nights. Having explored restless leg syndrome, we're ready for our next sleep disorder. Next, we dive into a less common but equally impactful disorder, narcolepsy. This intriguing sleep disorder is characterized by the brain's inability to regulate sleep-wake cycles normally. It's like your internal clock has gone haywire, leading to excessive daytime sleepiness and sudden bouts of sleep, even in the middle of an activity. The main symptoms are often mistaken for other conditions, leading to delayed diagnosis. They include cataplexy, where sudden emotional reactions cause muscle weakness, sleep paralysis, hallucinations, and disrupted nighttime sleep. Imagine feeling a sudden wave of sleepiness while laughing at a joke or being unable to move just as you're falling asleep or waking up. That's the reality for many with narcolepsy. This disorder can significantly affect daily life, making tasks like driving or operating machinery risky. It can also impact social interactions, academic performance, and work productivity. But remember, though it's a lifelong condition, it's also manageable with the right treatment and lifestyle adjustments. With narcolepsy covered, let's move to our final 2 sleep disorders. Finally, we have 2 more sleep disorders to discuss: circadian rhythm sleep disorders and parasomnias. Circadian rhythm sleep disorders, or CRSDs, are disruptions in a person's circadian rhythm, a natural internal process that regulates the sleep-wake cycle. This rhythm repeats roughly every 24 hours. When this rhythm is out of sync, it can lead to a variety of sleep disorders. Jet lag is a common example of a temporary disruption to the circadian rhythm, but some people experience chronic issues. The main symptoms include difficulty falling asleep or staying asleep at socially acceptable times, excessive sleepiness, and insomnia. These symptoms can lead to significant distress and impairment in social, occupational, or other important areas of functioning. Parasomnias, on the other hand, are abnormal behaviors or movements that occur during sleep. They are generally classified into two types: non-REM parasomnias and REM parasomnias. Non-REM parasomnias include conditions like sleepwalking, night terrors, and confusional arousals, and they usually occur during the deep stages of sleep. REM parasomnias, which include REM sleep behavior disorder and nightmare disorder, happen during the dream stage of sleep. The main symptoms of parasomnias vary greatly from one condition to another, but they often involve unusual or undesirable physical movements or behaviors that disrupt sleep. These can lead to sleep deprivation and other negative impacts on daily life, such as daytime sleepiness, poor concentration, and increased risk of accidents. Both circadian rhythm sleep disorders and parasomnias can significantly affect sleep quality, leading to a host of physical and mental health issues if left untreated. It's important to seek medical advice if you suspect you might be suffering from these or any other sleep disorders. Now that we've covered all 6 sleep disorders, let's summarize what we've learned. Now we've journeyed through the realm of sleep disorders, understanding their complexities and impacts. We've explored the relentless wakefulness of insomnia, the interrupted slumber of sleep apnea, the twitching torment of restless leg syndrome, the sudden sleep attacks of narcolepsy, and the disrupted internal clocks of circadian rhythm sleep disorders. We've also delved into the unusual behaviors during sleep, known as parasomnias. Each of these afflictions has its unique challenges, but they share a common thread. They rob us of the restorative sleep we need for optimal health and well-being. It's important to recognize these conditions, not just to improve our sleep, but to enhance our overall quality of life. So, we can't stress enough the importance of good sleep hygiene, seeking medical advice when necessary, and maintaining a balanced lifestyle. Remember, every good day starts with a good night's sleep. Do you often wake up feeling tired or unrested even after a full night's sleep? Please share your thoughts in the comments. Until next time, stay healthy and sleep well.